Next, we have Dr. David Rhew, who is the Global Chief Medical Officer and Vice President of Healthcare for Microsoft. He's also an adjunct professor at Stanford University, received his MD training at Northwestern, and has completed fellowships, did his internal medicine residency, and then completed fellowships in health services research and infectious disease.
Freddie, it's a pleasure to be here. I know I had an opportunity a couple years back to provide a keynote and also to be a mentor for several folks, and it was an exciting time. Hopefully I'll have an opportunity again, but thanks for inviting me.
So just to get things kicked off, we've heard from obviously brand new startups that are coming about in this space and trying to at least teach us about how to innovate in this process. We've heard from more of the academic perspective as well. One of the things that I'm curious about your thoughts is, and we alluded a little bit to this when Gil Addo was talking as well, was what are some ways in which technology can really help address health equity issues as opposed to potentially further exacerbating those issues?
Yeah, I mean, that's a great question. And in fact, that's always something that we're concerned about, that we may introduce in the process of trying to do good factors that could potentially exacerbate some of those disparities. Telemedicine would probably be the classic example. But I'd like to share with you an example of something that we've been actively engaged in. I personally have found to be very insightful relative to how we can look at the whole health disparity piece. And it relates to the rollout of the vaccinations. When really the vaccinations started rolling out, Microsoft leaned in and started identifying with our partners, and partners being countries and states and other entities, that there were a lot of gaps. Generally speaking, there wasn't a system in place to be able to do mass vaccinations. It was not really possible to do this on an EHR. Generally, most of the EHRs that were trying to do this were getting overloaded and crashing. In fact, what we found is that there had to be a different system set up. So we stood one up. It enabled registration, scheduling, and allowed people to be able to get the vaccinations in these large sites. But what was happening was that not everyone could make it to those sites. And in fact, what we realized is that we had to bring the vaccines to individuals in communities, whether they be in parking lots or churches or other areas that were in underserved areas. And that was, I'll say, the first step of how we were trying to address that. And in many cases, we were surprised that we actually still couldn't get a significant number of individuals vaccinated. And I think that became sort of that realization that we have to go beyond simply just making it accessible. And what we have to start doing is focusing on the human factors. The human factors in this case being a conversation with trusted individuals that have understanding and capability to be able to express why things are important, such as vaccinations, why it's important, not only from the societal perspective, but also from the personal perspective. And what we wanted to do is we wanted to have those conversations in the local areas by engaging local community leaders. That's a unusual thing for healthcare and public health to do, because we realized we had to empower individuals in these communities with the knowledge and with the tools. Oftentimes they actually did have the passion to do it, but just not necessarily the tools or the knowledge. And so marrying them with public health and with healthcare organizations in a process where we would actually host events that were not even healthcare related. They were like Cinco de Mayo or Mother's Day or return to school events. But then in the context of those events, we had literally a health fair. And it wasn't just COVID. It was about all the things that were missed during the pandemic. We're talking blood pressure screenings, diabetes screenings. We're talking about cancer screenings, enrolling people into insurance programs. And this process seemed to work very well. In fact, we've had great success already now in the state of Washington. We rolled this out specifically in the Latinx populations. Then we started moving towards California, engaging more partners in this process in predominantly migrant farm worker communities, and then continue to move to Georgia, where in one of the areas, Clarkston is considered one of the most ethnically diverse in the United States. Big challenges around language and also issues around, just immigration concerns. And then we had an outreach from the state of Mississippi, which had the lowest vaccination rates in the country and the highest mortality rates. And we've now been able to have these events, and some of the key success metrics is that we've been able to get about, in these events, typically 400 to 600 individuals. A third of them are vaccinated. And then in addition to the vaccinations, a whole series of other types of health services have been delivered. And what we have found is that on the second event, where they would oftentimes come back, there would be about 2 to 3 times as more individuals that would come back because the family and the friends were being brought in by the original individuals. And so what does this teach us? This taught us a few key lessons. Well, first and foremost, we oftentimes think that simply providing the technology is good enough. Not so. Needed to actually make it accessible, easily accessible. And that wasn't good enough, because then we had to go to the next step of actually finding ways that we can empower the individuals around consumer or around engagement and addressing the questions and concerns. And I think that's really what the playbook is. It's about trying to understand how we can apply technology in all these different capacities, but leveraging the power of the communities to be able to have those conversations and be able to provide the infrastructure needed to make this scalable.
And you brought a really good point around how do you build that trust. Can you talk maybe about kind of where some of those challenges that you've seen and how to best overcome that challenge of building that trust with those communities, especially, like you said, the communities that often distrust the healthcare system in a lot of ways?
Yeah, and it's a great question. And there's a lot of reasons for that distrust, if you look just at the history. But what we were looking at was not so much that it was coming from the healthcare provider or from any other entity that was external to the community. It was coming from local trusted leaders. These oftentimes were folks that we hadn't even anticipated. So for instance, when we were in Mississippi, they told us in the populations we were looking for, go to the beauticians, go to the barbershops. That was something that we hadn't even thought of, but that we followed their direction. When we were in California with the migrant farm workers, they said, you've got to go to the employers. These are the farmers that are dedicated to trying to ensure that the safety of the individuals are met. But at the same time, they're going to give time off. And they're also going to bring in the local community leaders. And so what we really wanted to do is we had to identify at a local level who are the individuals that are not only the people who can influence, but that can also inform. And then what we did is we had to marry them up with this trained healthcare specialist in the public health sector, because if it's just people talking about things, it's not going to be enough. You actually have to have the combination of both the healthcare and public health. And that's another key learning, that if we're looking to solve these complex problems, it won't just be one sector that solves it. It's going to be through public-private partnerships.
And it's really important point, especially the engagement of other sectors, especially in the space of equity, where a lot of the underlying issues aren't necessarily unique to healthcare itself, but really societal.
Absolutely.
So, in thinking about this hackathon and what the participants are, listening to all the speakers tonight, what are some key ways where sort of a bottoms-up approach to innovating into development of solutions compared to some of the top-down type of initiatives you've seen so far that could really have a meaningful impact in tackling health equity issues?
Yeah, these type of hackathons are well suited for addressing these type of issues. And I'll tell you a few reasons why. Typically, when we look at healthcare innovation, oftentimes the challenge is that it's based on clinical workflow. You've got to figure out some way to integrate it into an electronic health record, or you have to figure out some way to pull the data out. We're talking about people living in their homes, on the streets, on the go, outside of an EHR system. That's what we know. The people, everyone here knows people, and those people, we know the challenges. We have a deeper understanding of what the challenges are. We know how to be able to overcome them, but what we have to figure out is how can we work together to be able to build a system that's sustainable, that allows us to be able to address that. And that actually occurs outside of healthcare. What we have to do then is figure out how that process of fixing that problem can then be brought back into healthcare so that it can be delivered through a proper healthcare delivery mechanism, so that individuals will have consistent care that allows us to be able to address those issues. That's the challenge. It's actually an outside-in approach as opposed to an inside-out. And that's why the individuals here within this hackathon are probably going to have a lot of the answers that we need, but there'll probably need to be some coordination to figure out how those solutions will then be brought back into a complex healthcare system or a public health infrastructure.
I guess, from that perspective, as these teams start to develop potential new solutions, what advice do you have for helping them think about, okay, what's that next step in terms of either integrating into what's existing or scaling into what's existing, right? Or being that external innovation that comes into the system.
Well, I think one of the things you're going to have to think about is, first and foremost, is this something that we think is going to make a meaningful difference? A lot of times we see innovations that are, I'll say, nice to haves. It's a lot of effort required. But if we think this is going to make a significant impact, then do we have to ask, do we have all the right partners involved? A lot of times we forget, that this, and this happens all the time, whether it's on the healthcare side or external to that. If we don't have all the healthcare or the key stakeholders and we haven't thought about that process, that's not going to be a sustainable process. And lastly, and this is an area that we think a lot about, the data. There is data behind all of this. If I think about the vaccination, people oftentimes ask, well, what was Microsoft doing as part of this? I mean, you've got communities that are all engaged with public health. Well, at the end of the day, the data is now being captured. It has to be brought from the community into the electronic health record or into the state immunization registry. It has to be secured. There has to be a process so that the second follow-up is made. And so don't forget about the data. The data is a critical piece. It's an infrastructure piece that allows us to be able to create that sustainability. So you've got the right people, you've got the right infrastructure, but then you've got the right data platform that supports it.
No, that was some great advice, and I really appreciate you talking to our participants today, Dr. Rhew.